So thanks, Munir. Yeah, I'm Ellen Graham, and I work in a new unit called the Genomics unit in NHS England. And I think what's really helpful is I can follow on from Keith, who set out that big vision about what sort of our challenges are around medicines, and link that to what we're doing from an infrastructure perspective around genomics. So unfortunately, Sue can't be here today, but Sue's asked me to come here and to speak to you about what we're developing for the genomics infrastructure for the future. So before I get into the detail about what our future infrastructure is, I thought I would just talk a bit about the context in which we're working within. So the whole purpose of what we're trying to do is to enable a quicker diagnosis for patients. So for some patients who have never had a diagnosis, we want to help get them a diagnosis. We want to help match people to the most effective medications and interventions, and we want to help increase survival for those with cancer. So there's huge benefits from following a personalised medicine approach underpinned by a genomic approach. But we're not just starting from nowhere. There's a huge history here in the UK. There's been significant investment by the government into genomics, and this slide just sets out what some of those investments have been. We have a long history. So we've got genetic labs in the NHS, and they've been around for years. I've seen John over there in the corner. I'm sure he can set out a big history of how these came about, and they evolved over time. But we've also had a significant investment. We've had over £600 million invested by the government, announced by David Cameron for the 100,000 Genomes project. And more recently, Dame Sally Davis, our Chief Medical Officer, set out in her annual report something called Generation Genome, and she set out what some of the benefits are for genomics, but also about how we can take them forward in the NHS, and she set out a number of recommendations. So the whole point of what we're trying to do, and this is what Keith was talking about, Munir set some of this out earlier, it's all about achieving an earlier diagnosis for patients. It's about achieving a more precise diagnosis, which can help to target treatments more effectively and reduce the number of adverse drug reactions. But I think the purpose of this slide is to show that this is a really iterative process. We need that information about which treatments work for which patients, which ones are most effective, and this is a cycle. So as we learn more, we can embed that and change medical practice to make it better for the next generation or the next patients coming through. So this is just really, really key that we put patients at the heart of this. Jules and I were talking about this earlier before we came in this morning, and I think that's what's really, really key for taking this forward. People need to have trust in the system that we're creating, but also that they can see the benefits of what's happening with what we're doing with that information. So what we're trying to do with our Genomic Medicine Service is to create an equitable system with access for people across England. So what's really important, it shouldn't matter where you live about whether you can access this or not. So if you live in the middle of Cornwall, you should still be able to have access to the same tests if you live around the corner from one of our tertiary hospitals. We want to have a system that operates to common and standard protocols across the system. So there should be a high quality of service across the system. We're creating a system which has a single list of tests. We call it our National Genomic Test Directory, and that's the first time that we're going to have identified all of the genomic tests that are available in the NHS, which clinical indications they apply to, and who funds them. And I think that's really important. We've never done it before in cancer. We built on the history of the UK Genetic Testing Alliance, network. But going forwards, we're going to update this list annually and based on the latest evidence. So this is our opportunity to identify which are the best tests going forward and which are the ones that can deliver the greatest value. So it will be really key that we have a clear and transparent process about how we identify which tests go into that directory and which ones we prioritise going forwards. And the final point, which is what I was talking about earlier, this is about building a single place to store the data which patients have consented to, and that place can help drive these new drug discoveries, help us to identify effective treatments, and help to drive that cycle going forwards. And I'm sure Mark will talk more about that in his talk shortly. So at a high level, what we're trying to achieve with the Genomic Medicine Service is about creating an integrated service across our genomic laboratories, with our clinical genetics services, and with our NHS Genomic Medicine Centres, which we've created through the 100,000 Genomes project. So it's about creating an integrated delivery model, and it's about being underpinned by and delivering quality. So we talked about the standard operating processes and procedures, and that's all about high quality testing. It will be underpinned and needs to be driven by developing our workforce, so people need to understand how to embed this in the system and be supported to do so. We have lots of experts across the country, but as this comes into routine care, those that aren't exposed to it routinely need to really have the support to know when to use it and how to interpret the results, or how to access advice when they don't know how to interpret them. We can't do this without an integrated informatics system, so that is all about building that database, but also about pulling that information through and making sure that we can actually support the integration of the service going forwards. And fundamentally, this is about making sure that we're delivering best value, both for patients now, so that we're getting the best outcomes, but also about delivering value for taxpayers. So we need to make sure we're delivering those efficiencies. So the key elements of the Genomic Medicine Service are set out on this quite busy slide, but essentially this is about creating a genomic medicine service to underpin personalised treatments and interventions. And the key elements of the infrastructure, in the centre here we've got our national laboratory network. So we're currently out to procure up to 7 new genomic laboratory hubs. And what's different about these new laboratory hubs is that they will be delivering an integrated testing service. And they'll be working as a network, working together to deliver the National Test Directory. So that test directory will set out which tests they deliver, which technologies those tests should be delivered on, and who should be accessing those tests. And that directory will list tests from single genes all the way through to whole genome sequencing. We'll have an evolved role for the clinical service, so the NHS Genomic Medicine Centres and the clinical service. We're trying to work through at the moment, working with people from out in the system, how best to achieve that going forwards. So we'll be looking at how to evolve the specification for the clinical genetics service and how to integrate that with NHS GMCs going forward. We'll be working in partnership with Genomics England to create that informatics infrastructure that we talked about and the architecture that drive that with the data standards that people can work within it. We'll be securing whole genome sequencing provision for the NHS. So rather than having a number of sites doing things differently, we'll be having a single place, and we'll be driving that together with Genomics England. And this will all be underpinned by developing the workforce. So building on the work through Health Education England on the genomics education programme, we'll be thinking about what things we can do going forwards. I can see Annika at the back there, so I'm sure if you want to find out more, she can set that out for you in one of the breaks. And this is all about driving industry, academic and international partnerships. So I think it was back in the summer, it was published, the Life Science Industrial Strategy set out what the UK government want to do to drive some of these partnerships going forwards. So this infrastructure that we're creating can help to implement that vision that Sir John Bell set out, and it can help to ensure that we can share the learning across the world and get more value out of that information that we're gathering. So the timetable that we're working to is incredibly ambitious. I'm sure those that are involved in the procurement locally for the new laboratory infrastructure are fully aware how challenging this is. But we're out to procurement at the moment, and bids will be back in during March. We'll be announcing who's been successful from the procurement process to identify those laboratories in end of April, early May, and then people out in the system will be setting those laboratories up. So there'll be a mobilisation for 6 months so that the system can become operational from October 2018 onwards. I think it's important that we stress that we're on a journey with this, so we're not going to have it all perfect from the 1st of October, but we will have lots of the infrastructure in place from that point onwards, and we will be working together with the system to help drive this going forwards. And this will be an iterative process. So each year, as we update the test directory, we'll need to work with those out in the laboratories and others across the NHS and academia to work out which tests need to come through, how they can be operationalised in the NHS, both in terms of our laboratories, but also our clinical service. And finally, I just wanted to end with this. So Keith's already hinted that we've set up a working group to start thinking about how we could take forward some of our pharmacogenomic tests in the NHS, and I'm sure Mark will talk in more detail about what they've been doing. But I wanted to say what a huge opportunity this is today. We've got a huge amount of experts in the room, and we are starting to think about how we can really genuinely drive this forward in the NHS. So from a selfish perspective, I hope we use the next couple of days to start thinking about where should the NHS focus its efforts over the next 1, 3, 5 and beyond years. Like I said, we're on a journey. We need to really think about where we should begin our journey and where we want to end up. I think we need to think about how we can best approach implementation to ensure that we deliver against our aims. That's about equitable access for people across the country, but also which tests we should prioritise first and how we can best support that to deliver value. This isn't about putting any tests we can in, it's about putting the tests in that can deliver the greatest value up front. And I think, although we don't want to think about challenges necessarily, but we want to think about what some of those practical barriers could be to implementation and how we can best approach them up front so that we can have a systematic approach to implementation going forwards. So I'm going to stop there. Thank you.